My name is Dr. Teresia Wangari Kang'ethe. I am a dentist by profession with a special interest in pediatric dentistry and orthodontics. I am the owner and the practicing dentist at Smiles and Grins. It's a dental private practice on Kiambu Road at Feruzi Towers. Today, in partnership with Ponea Health, we're going to talk about dental caries. Dental caries is a disease of tooth hard tissue, that is the enamel, the layer you can see, as well as dentine, the second layer of the tooth, or cementum, which is the covering of your roots, that is usually caused by bacteria in the mouth and leads to various degrees of tooth problems, such as having cavities that will give you sensitivity, or even having cavities that lead to infections in the pulp space, leading to what we usually consider pulpitis. When it comes to the risk of dental caries, as dentists, we consider everybody, for as long as you have teeth in your mouth, as somebody of high risk. There are people with higher risk than others, but generally everyone, for as long as you have teeth in the mouth, will be at high risk. The reason being, from a dental perspective, we all do consume sugar. We consider sugar as food for bacteria. And once bacteria have food, they usually will give off acidic substances. The acidic substances are what breaks down that hard part of the tooth, leading to what you consider the hole or the cavity or the caries. So anyone who consumes any sugar, and from a dental perspective, if we can be specific, sugar is anything that bacteria can break down to give an acid. So that includes milk, it includes fruits, it includes almost everything that you can eat. So usually everyone will be at risk of dental caries. The people at a higher risk are those people who, one, do not clean their teeth adequately enough, and that means not brushing your teeth twice every day. That also means not flossing your teeth at least once a day. Also, people at a bit of a higher risk are people who have any physical immobility problems, physical mobility problems that will give you difficulty in doing fine actions. So we're talking about patients who would have diseases such as autism. We're talking about people of old age, because also their ability to be able to do the small, fine movements is also reduced. Other people at high risk are people who on a regular basis consume refined sugars. Now your refined sugars will be sodas, there'll be artificial juices, there'll be biscuits, there'll be candy, ice cream, all those will be your refined sugars. Other people at high risk will be in children especially, people taking syrups, medication for a long time, mostly because most of the syrups in children will be flavored with sugar to make them more palatable for the children. Other people who will be at high risk is anyone with a developmental problem on the teeth themselves. So in cases like dental fluorosis, where the teeth are no longer smooth, they're quite rough, they can hold plaque and things like that, that would also lead to a higher risk of dental caries. Some of the common practices that put us at risk of dental caries is, one, skipping brushing twice a day. Especially if you skip the night brushing, we usually consider that the whole day you've been feeding, there's food left on the teeth. At night you close your mouth. Now the bacteria in the mouth do not like oxygen. So when you've closed your mouth and you're sleeping at night, they have all the time to cause damage. So especially if you don't brush your teeth before you go to sleep, that is usually one practice that will lead to higher incidences, higher chances of having cavities. Another practice is consuming too much refined sugar. From a teeth perspective, I'm not saying that the quantity does not matter, but the frequency of how often you consume the sugars matters more. So someone who takes, say, 500 ml of soda in one sitting and finishes it all is doing better than someone who consumes only 200 ml of the same soda, but in 4 30-minute breaks. Yeah, so the frequency of taking the sugary stuff also matters. Apart from that, not visiting your dentist, not having regular cleanings, because no one is 100% in how you clean your teeth. You will always have some plaque left on your teeth. So for as long as you have that buildup, it puts you at a higher risk of getting caries, especially around the gum lines or on the biting surfaces of your back molars. The progression of dental caries is usually interesting in that when it has only affected the very outer surface of the tooth, what we usually call the enamel, there is a certain degree that you can stop the progression of that cavity, usually by improved oral hygiene either by having cleanings done at your dentist and fluoride application on those teeth, as well as improving how you're doing your cleaning at home. However, once the caries has already progressed from just the outer layer, the enamel, into the second layer, the dentine, or once the caries has already formed a hole, you're not able to stop the progression. And the only way to manage such a situation is by going to your dentist, having a filling done, having a root canal treatment done if it's necessary. Yeah. Thank you for joining us in this discussion. You can book our services at ponea.com. We look forward to engaging with you more in our coming episodes.